Identifying hand bones on X-ray and describing fractures. Hi there, my name is Connor McSweeney and I'm a fourth year medical student at the University of British Columbia. Today I'm going to be doing a presentation on common hand fractures and how they appear on X-ray. There are many different bones of the hand, including the distal radius and ulna, which are not shown here, the 8 carpal bones, 5 metacarpal bones, and 14 phalanges. Here we can see an X-ray of the wrist bones, which include the trapezium, trapezoid, capitate, hamate, scaphoid, lunate, triquetrum, pisiform, and distal radius and distal ulna. All of these bones can be fractured, and identifying these fractures on X-ray is a very complex topic that we will save for a different presentation. Today we're focusing on the metacarpal bones and the phalanges. The metacarpal bones are numbered 1 through 5, and we can see them labeled here in the X-ray, starting at the thumb and moving toward the pinky. Digits 2 through 5 each have 3 phalanxes: the proximal phalanx, the middle phalanx, and the distal phalanx. They also have 2 interphalangeal joints. The proximal interphalangeal joint, or PIP joint, is located between the proximal phalanx and the middle phalanx. The distal interphalangeal joint is located in between the middle phalanx and the distal phalanx. D1, or the thumb, has 2 phalanxes, a proximal and a distal, and only 1 interphalangeal joint, also called the IP joint. Metacarpals and phalanges are long bones, which have a common anatomy. It helps to understand the anatomical terms of long bones in order to properly describe the location of fractures. The diaphysis is the central part of the bone. It is often called the shaft, and it is highlighted here in yellow. The epiphysis is the rounded end of the bone. It is often called the head if it is the distal epiphysis, or the base if it's the proximal epiphysis. The epiphysis articulates with other bones to form a joint, and it is highlighted here in green. Lastly, the metaphysis is the portion of the long bone where there is widening approaching the ends of the bone. It is often called the neck. This is the area where bone growth occurs in adolescence. The metaphysis is highlighted here in red. When we look at a phalanx on radiograph, we are able to identify the anatomy of the bone using terms that we would use to describe long bones. Each phalanx will have a base, which is the proximal epiphysis, a shaft, which is the diaphysis, and then the head, which is the distal epiphysis. The exception to this is the most distal phalanx will not have a head, it'll have a tuft, which is the fine calcaneus bone at the distal tip of the distal phalanx. Whenever we assess a hand fracture, the most important thing is to clearly see the fracture well enough to make decisions on whether it is operative or non-operative. Generally, we try to get 3 views. However, if you cannot visualize the fracture well, more information is needed to make a definitive management plan. Often, this is an indication for a CT scan. The most common views of the hand are the PA view, the oblique view, and the lateral view. Now, on to describing a fracture. It is very important to know how to clearly describe a fracture for when you're calling an attending or resident. If we are able to clearly articulate what we are seeing, this can be of great help to the staff on the other side of the phone. This can seem like a daunting task, like in the photo we see on the right of the screen. But if we have a clear, systematic approach, we can accurately describe even the most complicated fractures. We will typically describe fractures using the location, fracture type, degree of displacement, and any special features. The first thing we want to do is describe the location. Was it the left hand or the right hand? Which finger? Which bone of that finger? And which area of that bone? Using these terms, we can clearly describe a fracture at the base of the left 5th proximal phalanx, or a fracture at the right third metacarpal midshaft. Next, it's important to describe the type of fracture. There are many types, but these are some of the most common. Transverse fractures, as seen in the leftmost X-ray, are a break that is a straight line across the bone. Oblique fractures are diagonal breaks across the bone. Spiral fractures is when the break is spiraled around the bone. This is common in a twisting injury. These fractures can be difficult to distinguish from oblique fractures, but often have very different mechanisms of injury and management, so it's important to be able to spot them. Lastly, butterfly fragments are when two oblique fracture lines meet and create a large triangular or wedge-shaped fragment located between the proximal and distal fracture fragments. This triangular fragment often resembles a butterfly, hence the name. Other fracture types include comminuted fractures, which occurs when the bone has splintered into more than two fragments. This can be seen on the first picture at the fifth proximal phalanx. A butterfly fragment from the previous slide is an example of a type of comminuted fracture. Next, we have intra-articular fractures, which is a fracture that involves the surface of the joint, or the articulating surface. This can be seen at the base of the first metacarpal in the picture on the right. Other common fracture types include subluxation and dislocation. A dislocation is a separation of two bones where they meet at a joint. A dislocated joint is a joint where the bones are no longer in their normal position. A subluxation is basically defined as a partial dislocation. It can be just as painful as a full dislocation, but the two bones that form the joint are still partially in contact with each other. Often, subluxations will have something called a dorsal V sign on a lateral radiograph. As we can see in the second photo down, at the proximal interphalangeal joint on the dorsal side, there is a larger gap in between the proximal phalanx and the middle phalanx that appears as a dark V-like structure. When we compare this to the photo above, we can see it's quite prominent. This is a good example of a dorsal V sign. Below that, we can see two photos of dislocations, one where the finger has been dislocated dorsally and one volarly. Whenever we describe a hand fracture, it's important to distinguish if there has been any displacement. Displacement is movement of the bone out of its normal anatomical position. Whenever we describe hand fractures, we use the term ulnar to mean the side of the hand closer to the ulna and the pinky finger, or radial, which means closer to the radius and the thumb. We also use the term volar to describe structures closer to the palm of the hand, and dorsal to describe structures that are closer to the back of the hand. We use these terms to describe the alignments of the bones around a fracture. We also describe the distal portion in relation to how it's moved compared to the proximal portion of the bone. So, for the deviation on the left side, we can see there is a third proximal phalanx fracture with ulnar deviation of approximately 15 degrees. Fractures can often have an apex, and they can be useful in describing the fracture to mention the side of the bone where the apex is. In the photo on the right, we have a dorsal apex and volar head angulation. Other types of fracture displacement include translation, which describes the movement of fractured bones away from each other, rotation, which is a type of fracture displacement where there has been a rotation of the distal fracture fragment in relation to the proximal portion, and impaction, when the broken ends of the bone are jammed together by the force of the injury, often resulting in shortening and commonly occurring with comminuted fractures. Now we will be describing special fractures, or commonly seen fracture patterns. The first of which is the boxer's fracture. This occurs, you guessed it, through impact of the hand when in a fist position, like when a boxer is punching. The fracture occurs at the 4th or 5th metacarpal head with flexed and volar displacement of the distal portion of the metacarpal. Next, we have tuft fractures. This is fracture of the fine calcaneus bone at the distal tip of the phalanx, also known as the tuft. This occurs via a crush injury to the finger most commonly. This is the most common phalanx fracture. The next special fracture is an avulsion fracture. This occurs when strain on a joint causes a ligament or tendon to pull off a piece of the bone. You can often see a fragment of the bone that is still attached to the ligament or tendon. If we see in these two photos, we can see on the leftmost photo there is a small chip of bone that has been pulled free of the remainder of the bone on the volar aspect of the proximal end of the middle phalanx. This fragment of bone is likely still attached to a ligament or tendon. On the photo on the right, we can see that on the radial aspect of the distal portion of the proximal phalanx, there is a small chunk of bone that has become dislodged there that is also an avulsion fracture and is similarly likely attached to a ligament or tendon. Whenever we have an avulsion fracture, it's important to state the percentage of the joint that's affected and whether the joint is subluxed or not. These factors greatly influence the treatment of these fractures. The last special fracture is Abendance Fracture. This fracture occurs at the base of the thumb, resulting from forced abduction of the first metacarpal. It is defined as an intra-articular two-part fracture of the base of the first metacarpal bone. We can see an example of this fracture in both of these x-rays at the base of the first metacarpal. And that's all we have for this presentation. Thank you very much for listening, and I hope that you come away with this with a better understanding of how to approach describing hand fractures and identifying common hand fractures. Thank you.